What I have to do is I have to interpret and analyze the various imaging modalities such as X-rays, ultrasound, CT, but at present we don't have mammography. So basically what I do is the patients that are referred for CT scan, I give either definite diagnosis or differential diagnosis based on the history and examination and other investigations that the referring physician has provided. So it helps the referring physician to get a diagnosis and improvise the management and treatment of the patient's condition. So that's what I do. And I also have to look after the radiation doses. I have to make sure that the radiation doses are kept as low as possible, which means correct test is ordered for the given condition. For example, if for screening, basically we start with X-ray and ultrasound. Ultrasound is considered generally safe. It does not involve radiation, which is harmful for the body, right? So we start with ultrasound, and for trauma and other general cases, we do X-rays first. X-rays do contain a minimum amount of ionizing radiation, which is at the acceptable level. So it's okay to first proceed with X-ray and then ultrasound. And if you find anything abnormal, we proceed with the CT scan that we have. Okay, so example, we have various cases, conditions of diseases, starting from trauma, and then infection, tumors, and other diseases like cirrhosis, liver failure, kidney failures, and all that. They first have to do an X-ray or ultrasound. Yes. That's the first step. And if they find some abnormalities, significant abnormalities, they have to request for further CT. For MRI, we don't have it here, but if I tell you the indications, MRI is indicated when you have a chronic headache or chronic back pain. MRI is more sensitive in detection of abnormalities in the brain and the spine compared to CT. So I recommend doing MRI for those cases, and for cases of tumors, cancers, cervical cancer and rectal cancer is common in the country. So we do staging, MRI staging for those cancers. And for other body parts of the MRI, we do in Thimphu, it's limited because we don't have body subspecialists. So I'd like to stress on the fact that X-ray and CT scan, they involve ionizing radiation, which means if we do it repeatedly over a long period of time, it will cause some changes. I mean, it's a bit harmful for the body at the cellular level. If you compare X-ray and a CT, for example, if we do a whole abdominal CT, it's almost equivalent to about, based on how many phases of the CT scan is done. It will range from about equivalent to about 100 to 400 number of chest X-rays that we do. So compared to X-rays, CT scan involves a lot of radiation, and it has to be done only when it is indicated.
A single beam of X-rays passes through the body to capture a 2D image. Dense structures like bones appear white, while softer tissues appear in shades of gray or black. CT scan. Multiple X-ray images are taken from different angles around the body. A computer processes these images to create detailed cross-sectional 3D images of internal structures. 2. Image detail, X-ray, less detailed. Good for identifying bone fractures, lung infections, and joint problems. CT scan, much more detailed. Can distinguish between different types of tissue, muscle, fat, organs. Useful for detecting tumors, internal bleeding, complex fractures, and organ abnormalities.
So at the moment, we have only CT scans. No? So most of the patients are the adult population. We do CT scans for pediatric only if it is really necessary. For example, in emergency cases where obvious abnormality of the brain or spine has to be ruled out, we do it for pediatric population. Otherwise, generally, we don't recommend CT scan for pediatric population, and it's contraindicated for pregnant women. So we do CT scans only for general the adult population, and it's indicated for pediatric cases only if it's required. But for pregnancy, firstly we can find out a lot of information starting with ultrasound. So ultrasound is safe in pregnancy, so we can try to investigate as far as possible with the ultrasonography machine. If they really need, we have to suggest an MRI. MRI is it does not contain ionizing radiation. It does not use the X-rays, right? So we can do MRI and for the pregnant women, but they have to be referred to Thimphu because we don't have an MRI here. In the East, I think obviously the most common condition would be trauma. There are lots of cases of fall injuries and all that, and we do X-rays and CTs to rule out fractures and their complications. And secondly, I would say stroke is very common. Stroke, there are two types, so we have to do CT to determine whether it's the ischemic, which means whether there's a blood clot causing complications in the brain, or whether it's the bleeding type of stroke. So stroke is also a complication of non-communicable diseases. Third one would be cirrhosis, I think. Cirrhosis is a chronic liver disease. I see a lot of cirrhotic liver cases, at least 2 or 3 in a week, with all those complications. And I think the final one would be cancer is also very common here. I get around at least 3 cases of CT staging for cancer. When it comes to cancer, the most common cancer here is gastric cancer, followed by, I think, gynecological malignancies like ovarian cancer, cervical cancer, and endometrial cancer. And the next would be lung and liver cancer. And I occasionally see cases of bladder cancer as well. We do have a mammography unit, right? We had been providing mammography service till last year, but this year the mammographer has been transferred to JD, Thimphu Hospital, because they are planning to start a new breast imaging center for the first time in the country. So it might take a while the ministry, trains a new staff for the mammography technologist. Breast screening can also be done with ultrasound. The sonographer here will ultrasound if it's indicated, and in cases that need screening or diagnostic mammography, we are having to refer all the cases to Tempula at the moment. For people who are having, chronic headache and backache, they want to do a CT straight away. I would like to stress on the fact that CT contains, CT involves radiation exposure, which means it's harmful for the body if it is repeatedly done over a long period of time. Like I mentioned, for example, a CT scan of the head would be equivalent to about 20 chest x-rays, whereas it depends on which part of the body you're imaging actually. CT scan of the abdomen would be equivalent to about 100 to 400 chest x-rays. So it slightly increases your risk of, cellular changes at the molecular level. It happens. It's the young population is more vulnerable to such changes. So there's a small risk of getting cancer with, accumulative radiation exposure in the long run. So we generally try to reduce the CT, CT scans for young population as far as we can. And I would suggest that MRI, patient should go for MRI instead, which is generally considered safe. It does not involve radiation, and also ultrasound. Ultrasound is also safe for all kinds of population. That will completely depend upon the disease that you're having or the condition that you have. For example, in cases of cancers, you will definitely have to, do follow-up imaging to look for the extent of the disease. And like I said, for general conditions, if it's not really indicated, I would like the public to, go for safer imaging modalities such as ultrasound and MRI. But for other conditions, it depends on the severity of the disease and what the referring physician is trying to, rule out or diagnose. And yeah, it will depend, it depends on case-by-case basis. Now we have about 11, including me, the 11 staff in the radiology unit. So starting with ultrasound, if I give you some data about last year, a total of about 9,000 ultrasounds were done, and we have only 2 sonographers, and it's a bit, I think the caseload is very high, and the cases are increasing every year. So, and to add on it, I think we are in shortage of sonographer who is trained in Doppler ultrasound. Doppler ultrasound is a study of the vessels of the body, any part of the body. No? And we look for whether the blood vessels are working well, whether there are clots, any abnormalities of the vessels, including obstetric ultrasound of the umbilical artery Doppler to assess fetal growth in the obstetric population, or we do Doppler ultrasound in the newborn's brain as well. So when it comes to Doppler ultrasonography in this hospital, I think we are in shortage of an additional, like we need an additional sonographer. It's quite difficult for the two sonographers to manage by themselves. And in X-ray unit, we have 3 staff right now. The mammographer that I talked about, after she was transferred, we haven't got a replacement, so it's also the X-ray unit is also having some difficulty managing the 24-hour service that we provide. And in CT unit, we have about 5 people, 5 staff. One is a CT nurse. There are 2 technicians and 2 technologists. And I'm including me, it's 6 in total. So as coming to me as a lone radiologist, I think sometimes it is a bit challenging. Firstly, it's not easy to be on call like 24/7 for the whole year because the cases are increasing every year. Last year, the total number of CTs done were about 1,400. And this year it's just 3 months and we have already crossed 500. So I get emergency cases on a daily basis. So it's a little bit more challenging when the cases come like all together at once. And the other thing is, since I'm the lone radiologist, it's a bit difficult to get leave. For example, if I get sick or if I have to avail annual leave, I will not get a replacement. So I have to be on call while being on leave. So I have to report emergency cases. And another thing about CT here is, since the patients come from very far places and they come from low socio-economic background, because of that, we are not giving appointment. We don't have the appointment system that is usually done for CT scans. We do CTs on a walk-in basis. It's like OPD. They come to the OPD, and on the same day, if the doctor orders CT scan, we do on the same day. I report it on the same day, and everything is done, finished on the same day. So because of the geographic diversity, we don't give appointments. So if I am on leave, the routine cases will be done, and after I resume my work, I have to report all the cases. So it's a bit challenging after I resume duty. So that's one area, but other than that, I think the caseload is manageable here, and we are doing our best with the facilities that we have. At the moment, we are not able to give mammography services, and we are referring all such cases who need mammography and MRI to the National Hospital. And apart from that, we have all the equipments such as X-ray, ultrasound, and CT to diagnose most of the conditions and diseases prevalent in the eastern region. And I would like to take a minute to thank the team of BBS for sharing this important platform with the goal of spreading awareness among the public about various aspects of health.